Now, a major health scare aboard a cruise ship has triggered international concern, even as evacuation operations began off the coast of Tenerife in Spain's Canary Islands. The MV Hondius reached Tenerife early on Sunday after sailing from Cape Verde on 6th May, following a deadly outbreak linked to the Andes strain of hantavirus. Well, 3 people have already died from the infection, while 5 passengers who had earlier left the ship later tested positive. Spanish authorities and the WHO and the cruise operator Oceanwide Expeditions have said that none of the people, more than 140 people still on board, were showing symptoms when the evacuation process began. Now, passengers were ferried to shore in small launch boats carrying between 5 and 10 people at the time. According to Spain's health ministry, Spanish nationals were given priority during the evacuation process. All passengers disembarking from the vessel are expected to undergo medical screening before boarding evacuation flights arranged by their respective countries. Spanish Health Minister Monica Garcia said that the entire operation is proceeding normally. Take a look at the special report.
3 people have died in an outbreak of a rat-borne disease on a luxury ship. So what exactly is hantavirus, and should you be worried about it spreading?
They're relatively rare infections.
Daniel Bausch is a specialist in tropical diseases at the Geneva Graduate Institute in Switzerland. He said the virus is only rarely passed between humans and is most commonly spread when people have contact with rodent droppings, urine, or saliva. But a cruise ship might create the conditions for person-to-person infection.
We know that cruise ships and other events where we pack a lot of people into small places, that they always have the risk of human-to-human transmission of different pathogens.
Hantavirus usually begins with flu-like symptoms such as fatigue and fever. 4 to 10 days later, coughing, shortness of breath, and fluid in the lungs appear.
And so we can see in hantaviruses that people develop essentially a pneumonia or a consolidation of fluid filling up in their lungs, and that can happen very rapidly.
Bausch says there's no specific antiviral drug for hantaviruses. Treatment, he says, often requires hospitalization in an intensive care unit.
It's not the sort of treatment that is generally available on a cruise ship.
The World Health Organization said it's been told there were no rats aboard the ship. Its working assumption is that the cases originated in a Dutch couple who joined the ship in Argentina. That couple may have been infected before joining the cruise.
Hantaviruses have or can have at least a relatively long incubation period. Incubation period is the time from when you get exposed to something to when you fall sick. And so in hantaviruses, that can be, in extreme cases, up to 6 weeks.
The World Health Organization assesses the overall public risk from this current outbreak to be low.
This is not the next COVID-19. This is not going to be a big outbreak. This is not a reason for your average person in the world to panic at all. If you had tickets for a cruise, I don't think you need to cancel it. And now that you know that it's possible, because it's pretty rare.